and what's up, beautiful people? This is your tooth doctor, Maureen Mora. Welcome back again to my YouTube channel. All we do is talk matters oral health, and it is simply because I believe everybody is entitled to good oral status. And guys, in today's video, it's how can I say it? In today's video, it's something that has I've been a patient of it in simple terms, and this is something we call mouth ulcers. Me, I call them source of agony. Some people can call them canker sores or after ulcers in technical terms. These mouth ulcers, although they come about temporarily, they can be very uncomfortable. And for the folks out there who are experiencing the mouth ulcers like right now, one thing I can assure you for free, once they start healing, you are going to feel like the champion of the world. And I'm saying so because I have had them. I've known how pissing off they were, but we managed it, so you will manage it as well. So what you need to do is stay tuned to this channel. I will be giving you tips on how to manage it, and we will smile all the way. So canker sores or mouth ulcers, basically this is an ulceration or ulcerations in the oral mucosa or in your mouth. By oral mucosa, I mean your cheeks, your lips, your tongue, your soft and hard palate. Sometimes they may appear reddish or yellowish in color, and many a times there is no serious underlying cause. However, ulcers that are not healing within a stipulated period of time can, although not always, but sometimes they can be a sign of an oral cancer. So guys, the causes of these painful mouth ulcers can include certain foods like chocolates, coffee, peanut, some acidic foods and drinks as well. We also have cases of trauma, which can be either from braces, you biting on your cheeks, if you have a broken tooth, trauma from dentures as well, if they are not fitting well on your gums. And we also have some rough foods. They can hurt your cheeks and end up causing some painful ulceration in your mouth. A typical mouth ulcer should heal within 1 to 2 weeks. So if you happen to be having a mouth ulcer that is not going away within after 2 or 3 weeks, then you really need professional dental check such that they get to see if it is something else other than just a normal mouth ulceration. So for you to be able to establish that you have a mouth ulcer and not something else, here an oral examination is going to be carried out by, of course, a qualified dental practitioner, and you will find they will be asking you questions like the duration the ulcer has been there, the number of ulceration on your mouth, how it is appearing, and even the size as well. So it is good for you to give your dentist or your oral health caregiver good information for them to be able to reach out into a good diagnosis of your presentation or towards your mouth ulcer. So guys, when it comes to the management of painful mouth ulcers, Honestly, this is one of those topics that I have a whole range of tips on how to manage it. I don't know, it's because I have suffered from that before, but anyway, I'm going to give you those tips on how you go about it. But then the management, or rather the treatment of painful mouth ulcers is it's better if you deal with the cause and even the underlying symptoms. So for instance, number one, if you are experiencing very painful mouth ulceration, key tip number one is, if you are you are planning to visit your dentist and you want some home remedies, number one, you can use over-the-counter analgesics like paracetamol, but try and stick within the prescribed dosage. So once you have done that, try and rinse your mouth with warm salt water. This can be soothing to the ulcerations, and also they can help in decreasing on the inflammation. Another tip to consider is good oral hygiene. I think this should have been my number one tip. Oral hygiene is key, and if not preventing, or it can help in controlling some of the oral issues like the painful mouth ulcerations. Also, I will want you to use, if you are having recurrent ulcers in your mouth, maybe they come, they go, they come again, they go, and as you plan to visit your oral health caregiver, try and consume some vitamin B12. This can easily be found in fish, in poultry, in dairy, and such like stuff. So try and consume that. You can apply honey on the affected side, but I have a disclaimer for this one. Ensure that the honey doesn't get to sit on your tooth for so long, because now, as we know, honey has sugar, and one thing for sure the bacteria in your mouth are not friendly with is sugars. So you ensure that it doesn't sit there for long, or else it might end up destroying your tooth. Also, avoid spicy food, because these ones, spicy and salty foods, because now these ones might aggravate the ulceration as well. And lastly, try and suck on ice chips. And I mean suck, not chew, because now again, chewing is not good for your teeth. You suck on the ice chips, because now this one can enable to create some numbing on that side, and it can enable reduce some sort of pain if you are having very painful mouth ulceration. Once you've put these tips into consideration, please make an effort to visit your dentist if these mouth ulcerations are becoming more painful in such a way that you cannot be able to eat well, or if they make you feel unwell generally. Yeah, so those are some of the key tips that I want you guys that you can apply. They might end up helping you get relief from those painful and uncomfortable mouth ulcerations. So that being said, a normal or a typical mouth ulcer will go away within, as I said earlier, at most 3 weeks. So if your mouth ulceration is not going away within that time, please ensure that you visit your dentist for follow-up and more management if need be. So let us get to meet in my next video. That is it from me for today. Bye bye.